All right, Kathy, would you like to do a welcome? Are you able to with your phone connection? Looks like Kathy is on mute, and I know, oh, yep, she's probably not able to. So on behalf of NAMI Yavapai and Kathy and the Northern Arizona Peer and Family Coalition, of which I'm the chair, just want to welcome everybody. And thank you for being here. There are a lot of folks who aren't able to participate during the actual meeting, so we do record this. And a lot of folks will view this after the fact. It's usually out within a few days of the meeting, available through the NAMI Yavapai website. So with that said, I'd like to introduce our panelists first, and I'll start with Stephanie. Stephanie Pethards. Did I pronounce your name right?
Yes, you did. Thank you.
Stephanie is the housing coordinator, program facilitator, advocate for West Care. She's worked in their domestic violence field for 9 years, 7 of them with West Care. She has a passion for helping victims and letting them know there is a way out through which they are heard, healed, and move forward. West Care works up in northern Arizona and the Kingman area and also Nevada, if I'm correct.
Yes, Bullhead City, Kingman, Lake Havasu.
Okay. Would you like to add anything to what I said?
Nope, that summed it up.
Okay. Next, I'd like to introduce Kelly Wells. Kelly is the program and property manager at Sharon Manor Housing Solutions of Northern Arizona. Kelly earned her bachelor's degree in social work at NAU and has worked at Sharon Manor Transitional Housing for Survivors of Domestic Violence and Sexual Assault for 5 years. Kelly, would you like to add anything to that?
I think the only other thing in my background that's helpful to my work now is I used to work at the Child Welfare Training Unit, so carrying a Department of Child Safety caseload. So I am able to help our current residents that are working within those kinds of systems. So that's a helpful background skill.
All right, excellent. Next, I'd like to introduce Cassie Resnick. Did I pronounce your name right?
You did.
All right, so Cassie is the Resident Services Director for the Verde Valley Sanctuary here in Cottonwood. She's been with the sanctuary for 5 years and served as the shelter advocate and as the lay legal advocate prior to her current position, overseeing the emergency shelter and transitional housing. Would you like to add anything to that, Cassie?
Not really. I've been in this current position for about a year, so I'm still learning all of everything that comes with overseeing the shelter and transitional housing. So it's been great.
All right, thank you for being here. Next, I'd like to introduce Corey Burke. Corey is the Services Director at Stepping Stone Services in Prescott. And she's been their main domestic violence advocate for nearly 20 years. So I know with that, I'm leaving stuff out. Do you want to add anything to that?
No, that's excellent. Yeah, we're really glad at Stepping Stones. We have a great team here, really great team.
All right, then. And next, I'd like to go to Shalene Seward. Seward or Seward?
Seward.
Seward. Okay, well, I was bound to stumble on one of them. Shalene is the executive director of Northland Family Health Center in Flagstaff. She's worked there for 15 years in a variety of roles, including shelter advocate, domestic violence shelter manager, director of the shelter and the youth shelter, director of services, and became the executive director in 2019. Would you like to add anything to that? Okay.
Struggling
Oh.
with the mute button, sorry. No, I used to also teach sociology courses at the university, the college campus, but that was well over 10 years ago. I feel like the students would teach me a lot now, so I don't include that too much anymore.
And I know you all did provide me with more, but I couldn't fit it all in on the bio page, on the flyer. So, moving right along into the discussion, we're really interested in hearing from you because you're seeing it happen. And some of you have been, well, most of you have been at this for a period of time. So I'm wondering if you can help identify for us, what are the challenges? What are the successes? And how is the relationship with interacting, collaboration with behavioral health in your community? Because sometimes there's a miss and sometimes it's excellent. So I'll just throw the ball in the court and let you all pick it up.
I could talk. So during COVID, we have definitely seen an increase in mental health conditions with residents that reside here. And when we really started to see an increase, it was in more significant mental health issues than we're really necessarily equipped to deal with as staff here at Sharon Manor. My case managers have social work backgrounds, but we are not counselors. And so something that we've seen is that at our local agencies, there's a lot of turnover at the mental health agencies in town. And so it feels like, at least from speaking with residents, they get tired of going and meeting with a counselor at one of our local places, and then the person leaves, and here they are re-bringing up all the trauma, telling their stories over and over and over again. So that's an issue. And then sometimes just the transportation or getting to where you need to go to see somebody who's experienced. So in the last year, we started to try to get creative. And so we had a meeting with Northland. I think Heather was there, Shailene, and the Guidance Center and a couple of our other local agencies. And we were able, the Guidance Center wrote a grant for ARPA monies to be able to get a counselor to come on to Sharon Manor property. And like once a week to meet with residents. We thought that may be an easier approach. Maybe people would be more likely to engage. Happy news, they did get that ARPA funding through the city, but up until today, I just heard they finally hired somebody, and those ARPA monies have to be spent by June. So while we creatively continue to try to problem solve ways in which to meet people where they are, we run up against barriers. And I'm guessing after talking to the clinical director at the Guidance Center, a lot of that was monies, people being able to afford to accept a position and live in Flagstaff. So, but we do get creative. It's just time restrictions. So now I wonder how that will work, and if the Guidance Center will be able to keep them longer than the ARPA funds. But like I said, I just found out from my boss today that they were finally able to hire somebody, and they've been looking for well over 6 months.
Wow. I think staffing shortages are an issue, and I'm glad you brought that up with the turnover factor. And in places like Flagstaff, it can be very challenging to find a place to live and afford to be there.
Yeah, I attend, I'll just speak to that really quick, but I also just wanted to share what Northland does within the behavioral health world. I attend the Arizona Coalition in Domestic and Sexual Violence Executive Director meetings, and And yes, throughout the entire state, people are still feeling the difficulties of hiring staff, particularly in our shelters, which leads to managers working in shelters, um, which leads to their own mental health, and burnout and concern of well-being, of, being really dedicated and making sure we have people available 24 hours a day. And when managers take on a large chunk of that, it is really important for leadership to make sure they're taking care of themselves as well. But so as Kelly spoke, so yes, it is very much the turnover is something that we hear of as well. And even just as case managers, they have huge caseloads. And so within our behavioral health programs, and so that being difficult for clients, whether it's starting services or not being sure who's going to be continuing to provide the services to them. Northland has a counseling department. We're grant funded, so all of our services are free. And we do trauma counseling, and our therapists are highly trained in trauma counseling approaches and somatic experience, etc. But we've had a wait list for at least the past decade. We always have a wait list, and we've had when we get interns, that helps with the caseload, but we also don't do paid internships. So what we're finding is counseling interns are going towards paid internships, which absolutely makes sense. But that doesn't help when we have, 10 to 20 people on a wait list. So one of the changes that we did recently, the counseling department used to not put a time limit on counseling services. We don't have to, since we're not grant funded, or we are grant funded, it doesn't go through insurance, etc. And so we would have people on caseloads for, several years still receiving therapy. And so they recently, within the last year, had to create some more structure around that, of a 3-year sort of time limit of kind of weaning. I don't know if that's the best way to put it, most professional way to put it, but year 1, you can have counseling kind of as frequently as needed, and then year 2 it's lessening, and then year 3 it might be like once or twice a month, in order to try to serve more people and maybe reduce the wait list at some point. The other part, I just wanted to share, as Kelly had mentioned about getting services out there, was prior to COVID, we only did in-person counseling, and COVID really forced us to learn what telehealth is. And that has just been a game changer for providing services. They still find most clients really prefer the telehealth method. It makes sense. You don't have to drive. You don't have to be in Flagstaff. You don't have to find childcare. You don't have to interrupt your workday. You can just pop on your computer. Sometimes you can keep your camera off if you're not comfortable in a setting. So they have found that has benefited a lot of people. It's also benefited a lot of teenagers. Seems like a lot of teenagers are electing to come to counseling more if they can do it over a virtual platform.
I'll just piggyback off of that as well. Staffing is an issue nationwide. It's no secret to all of us. I think in the mental health world, it's just a little bit harder. I'm blessed with a clinical supervisor, my VP, and then we have probably, I would say my counselor is the best. But you're right, the need for counseling is so much higher than the willingness of those counselors to work or find employment. And because our organization is grant funded in some programs and areas, and then also insurance billed, we kind of get to play with both, to where we're not going to turn anyone away if they have insurance or not. And whether they need, substance use, the mental health stems from there, or sexual trauma or domestic violence or single family homes or parenting, there's no avenue we can't cross. But like our shelter, funny, I just hung up with her this morning. We've been like 1 or 2 over for a few months now, and as far as bodies and beds and kids. And I don't know about you guys, but I've seen just in the last, I would say 6 weeks, a huge spike first people were saying it's the weather, and then it's election year, and it's after tax season, the money's spent. I know we all watch that flexibility calendar, but I'm hoping this year isn't starting like this, and this is not the summer we're looking for. But just to say too, that I think that if we start to make work a little bit, because like you said with burnout, I try to make sure all the staff has like break times, proper days off and time off, self-care. And if they don't know it, train them. So I go over once a month now, and I'm like, okay, I need you to list me what you're going to do. I want to see that you're taking care of yourself. Because I'm the first to tell you, I used to tell my supervisor, oh yeah, I'm gonna take time off. Oh yeah, I'm gonna do, and I never did until I was like, I'm gonna die, I need help. So just ensuring that they realize how important it is and not waiting till they get to that is helping the staff tremendously, tremendously. So we've been doing a lot of trainings on vicarious trauma and self-care and things like that to, you know, not make it a miserable place. Even though you love what you do, it's hard when you're at that level. So, and it's helping with employment as well. New employees are coming in and they're not so scared because we're running crazy. So it's been helpful. Just trying different tactics to get people to come to work and like it.
Excellent. I just want to point out in the chat, Sean has said that an option to create paid internship is to make it an AmeriCorps position. And he's put a link in there for you to check into. Thank you, Sean.
I really don't have much more to add that everybody has already said. You know, I feel like we're all kind of in the same boat. One thing that we lack that I would love in the future, funding, of course, you know, is always the biggest issue. You know, a lot of times is having a counselor or a therapist on site. We just don't have the means to do that. So we do have to rely heavily on our, you know, our mental health providers here, which I will say we do have a pretty good relationship with, that we're able to reach out when there's a crisis that maybe staff isn't able to handle, or things get escalated, that we, like I said, do have a quick response time from crisis departments locally, that they're able to assist us. But with being a rural town, and turnover rate, a lot of our clients do get kind of weary of our mental health services locally because of the high turnover rate, and they don't want to keep just funneling through, you know, the doors. We have seen a huge increase in mental health within our shelter, and it's more training with staff that, you know, maybe we weren't prepared to do, which is fine. You know, we meet people where they're at and we assess their needs and we kind of go from there, but it does get trying at times. But I would love, you know, to work towards winning the lottery so we could, you know, pay someone to provide those services within the department. We partnered with one local therapist. I'd probably say this was pre-COVID, who he would come to shelter and provide those services. But then when clients timed out, they weren't comfortable, you know, going anywhere else other than shelter to provide those services, and it got sticky with confidentiality. So we had to kind of restructure that. And then he ended up leaving the area anyway. But yes, we need more in-house mental health services for sure.
Yeah, Cassie, you bring up a really a great point. And I know Kelly and I have spoken about this as well. I was definitely seeing an increase of the mental health needs of our clients in shelter, which yeah, has led to us requesting more trainings from our state coalition and from therapists, and how can we collaborate? Like in-house, we our therapists we have a couple therapists assigned to our staff meetings to provide clinical support. And so we've increased that this past year. We've had to, just to help our staff, especially as we're seeing more turnover happening. You're constantly in training mode then. And so definitely increased our counselors' presence and discussion at those meetings to help staff kind of build the skills to work with like really difficult situations related to mental and behavioral health. And then we've also started doing more specific trainings, like instead of a staff meeting, we're going to dedicate this hour to just like a trauma-informed care. How does this tie into what we're doing training? I don't know where we would be if we didn't have those like pivots that we had to help our staff understand the work and maintain that like non-judgmental, helpful mode when you're going through really difficult situations, like week after week after week.
And I want to piggyback off what Shailene said, and the reason the idea for the ARPA monies came about is because we were really struggling as a staff to try to help people with that significant increase, because they were mental health illnesses that were well above what we know how to work with. And so I was basically begging for like more staff trainings, like we need more support. So we went, we all did mental health first aid, and then we asked the coalition, they made a training specifically from my begging of like mental health and domestic violence. And it's just really been a struggle, and it just really seems to have just gotten worse with the pandemic, people being in isolation, and the increase in domestic violence when people weren't being seen and were in isolation. And I think it's just all snowballed. And so it's just really been a challenge. We have been trying to do self-care as a staff together at least every other month. And so we'll take like 2 hours and we'll paint, or we'll do this. We played bingo. We just have been trying to promote that as a staff as well, because when your staff is struggling, as Shailene said, you want to make sure that your staff is getting the support they need and that they're able to stay and be healthy and be working at your agency. And so it's just been a really challenging time, I think, in the last few years.
Am I hearing that, Shailene, your organization is the only one represented here today that has your own counseling staff? The other agencies are reliant on behavioral health providers in the community?
Yeah, it might be. I know just even throughout Northern Arizona, we're one of very few programs that has no cost trauma counseling, which contributes to that wait list that we've had for 10 plus years. So there are other programs throughout the state that have domestic violence programs that have counseling elements. But I'm guessing they're located in the southern parts of the state.
I currently have 4 counseling on staff, it's also grant funded. So I do have that. And I was just looking at our numbers since January 3, which I don't know why I'm 3 days behind, but the mental health within the shelters is up 17%, which is probably on the low end if you asked me. But we also have counseling on staff 24 hours a day, 7 days a week. We started a little thing called peer support, which can be both helpful depending on if that's what they're going to school for. And then I wanted to touch base on, Kelly, your ARPA monies. I'm on a board for victim services within the county and the state. And you typically, because I do the same thing with grant funding and ARP funding, you can typically ask for an extension on that person's position due to the lack of filling it, or B, another year with the same funding. And 9 times out of 10, you'll get both. Because they'll go, oh, okay, not only does she need it, but let's extend it. So I would get on that really fast, because I know they're on me about spending my last bit of money until June too, which is nice, because you save thinking you're gonna run out, and then you're like, oh, okay, I can actually go buy a couple new car seats for the shelter or what have you, but another thing I wanted to say is something we started doing back in August of last year. I actually did the Train the Trainer, and I did a few others, is vicarious trauma. Because informed care and all these trainings we're doing are super great and helpful, but if they don't actually have the understanding that we take home just what we see sometimes or what we hear, and how that can be, and I'm an advocate, I go on women that are beat brutally or suicides and homicides, so I see it all, and I have to learn to do that myself, to actually explain to your staff what that means, as far as hey, you're feeling this way because you took this client's pressure, and which is good sometimes, but that in that reverse, it's like, we're feeling it now. So the vicarious trauma training is amazing. There's 2 different ones. I can share a link. It's really helpful to have someone come give that training, because then it's someone that explains from experience. So let me know if any of you guys do. Flagstaff's not far for me.
Yeah.
Why don't you go ahead and put that in the chat?
I
If
gotta
it-
find the correct one though, and I can't get on both screens
Okay.
right now because I have the dental people doing a presentation for the
Okay.
girls. So I'm kind of bounded, but I promise I'll share it with you guys.
Okay, and you have each
And we-
other.
Yeah, we do vicarious trauma through the trainings that's provided by our therapists. They're highly trained in that as well for that support, and it is really valuable, exactly, to
Yeah.
understand how that ties into the well-being of their jobs.
So Stephanie, I want to make a comment. You mentioned peer support, and you refer to it as a little thing. Peer support, being with the Arizona Peer and Family Coalition, we see that as a big, huge thing. And we actually have someone here today who isn't on the panel, but Carolyn, if you're able to come on camera and say something about peer support, because Carolyn just happens to be a peer support for one of the peer and family run organizations in Arizona. And so Carolyn, thank you for coming on camera. And she's in the Cottonwood Prescott, serves the Cottonwood Prescott area community, for those of you who are interfacing with Spectrum. She works for Hope Inc., which bilocates with Spectrum, but I'm sure after this, they may be looking at reaching out. I'm sure there will be some outreach to those of you who Hope does serve in the community. Carolyn, you want to say anything about peer support?
So I came to work for Hope off of peer support. I was a regular BHT in a health home setting. And watching the way someone's care and their healing changes when they see someone that has been through something similar and is on the other side of it. And it's like a direct connection in their brain to like, I can do this too. And it is just one of the most amazing things I've seen. And I've seen a level of progress with peer support added that I haven't seen in a clinical setting when it's not there. It just boosts the person. It really renews their self-esteem, their sense of worth. It's a substantial thing. And now that I've been doing it, I really couldn't imagine helping people without it. So it is, a lot of times it can make the hugest difference for the person to have peer support.
Thanks,
Yeah.
thanks, Carolyn. And I just want to add that Carolyn has gone through training. When you work with a community service agency such as a Peer and Family Run, we have Family Involvement Center up in Flagstaff and Prescott, working with kids and youth and families. These folks have gone through training to prepare them to do that work. Stephanie, go ahead.
I actually came from peer support too, many moons and years ago. So I'm an experienced educator, or I mean, comes from experience as both a victim and in recovery or what have you. But what I mean, little thing is, we were never allowed as an organization to we can hire them and have peer support on staff for minute things. Now we're able to use them more valuable. back before, I think I struggled with, they had to have certain educations and they had they had to have these certain things and trainings. Now we can work with them and build. So like you said, out of the 41 clients I have right now today, I would say 30 of them connect more with my peer support than they do my licensed clinical staff. It's proven fact. So, but we're able to use them more. I have 2 and I'm like, can I have another one? Can I have another one? Can I have another one? So it's super helpful. And then, you know, before you know it, they grow and learn and do bigger and better things too. And then we lose them.
Absolutely.
Yeah.
I'd like to speak to our shelter program too, where we have a lot of folks who go through and we have kind of a tiered system. They become a host after a while so that they can help orient and welcome new people that are coming to the shelter. And it has a little job description around it. So that helps us create a little less of a client caseworker model and a little bit more of a peer model, even though they aren't trained as specific peer support. After a while, they can also become mentors, which is an increased responsibilities. And it really takes that kind of 11th and 12th steps from the 12-step program and shifts, again, our client caseworker dynamic and asks a lot more from the folks who live with us. So even though this doesn't necessarily, we can't change the reality of our local, the availability of mental health services in-house, this has created a really neat dynamic where folks who have been there a little bit longer than the next person benefit themselves from sharing what they've learned. And then they also help bring in the next person. It really helps us offset, kind of supplant supplement the mental health availability. It also creates a little bit more of a long-term connection. So while they might have to wait to get into professional counseling, or they might time out of that, we focus on getting to supportive, let's say, recovery-based things, and to help develop fellowship and really, really push that, because that ensures the longevity. It ensures that they get a sponsor or somebody that they can contact all the time, as opposed to a therapist. But it works really awesome. And we've had folks train through stepping stones and then either get a part-time job with us or flip over and get a better job somewhere else when they found, oh, they've got CPR first aid, they have fingerprint clearance. We kind of help them go through those things. Sometimes they learn how to answer the helplines. So we really take advantage of the folks that live with us to help offset our advocates. And we ask a lot from the folks who've been with us for a while, or especially those who move into our transitional housing. They become mentors and are responsible for the shelter overnight even. Our paid advocates leave and the folks in our transitional housing take care of the campus and call us if they need anything. So we've really leveraged the folks who live there anyway and ask a lot to help them with the new folks that come in. I know that's not necessarily the professional behavioral health side, but in some ways that's proven to be more important and longer term.
And I know Stepping Stones has been longstanding in the community and has so many different branches and your store and employment. And I just wonder how many of the other shelters are expanded in services other than residential.
Yeah, the thrift store has a neat of it. We are able to provide employment opportunities too, with the goal of turnover, getting something better. The housing has been our biggest challenge these last couple of years. We recently purchased a duplex and now a triplex, and have got them all fixed up. Really, really awesome. Oh my gosh. And they're going to be full this weekend. Our last families are moving in. But the housing has really made sticking around here. I mean, and not to mention Flagstaff and Verde Valley, but the cost of living is really what's one of my biggest challenges is folks relocating to this area and the daily phone calls from other parts of the state looking for housing. It's just a hard place to relocate to for sure.
And speaking of housing, I wonder, I didn't ask all of you, what is your individual organization's capacity for housing? For transitional housing in your shelter? What capacity?
I'll start. We have our 20 in shelter plus beds, cribs, bassinets, and 1, 2, 3, 4, 5, and 8 transitional housing units.
Thank you.
At Sharon Manor, we have 29 apartments. And then we did just open another transitional housing. It's not DV specific, but it did just open in town, and that's another 44 units of transitional.
Yeah, Kelly's program, Sharon Manor, works under the larger umbrella of Housing Solutions of Northern Arizona. So they do a ton of transitional housing, which is great. Northland is shelter only. We have 24 beds for emergency shelter in the domestic violence shelter. Domestic violence, we call it domestic violence, but it's sexual assault, human trafficking, child abuse, family abuse, etc., as I'm sure most programs are. Maybe one day we'll find a different term for encompassing all of that. I also really like to share about our youth shelter. It's so important for people throughout Arizona to know that we have a youth shelter available. We have 15 beds for youth that are placed either through juvenile probation or Department of Child Safety, but also we have runaway and homeless youth beds, and those are flexible to use for youth who are running away, are homeless, or preventing them from running away or preventing homelessness. And I share that because so many kids are couch surfing, or they are in a unsafe environment because they don't know where to go. And it's just really, really important that as providers, as people who have contact with youth, or people who have contact with other people who have contact with youth, especially educators, that they know about the runaway homeless youth beds in Flagstaff, Arizona. And we can assist with, trying to figure out transportations and etc. To help youth. And the runaway homeless youth beds, it's federal, it's a federal grant, so there are specifics around it, but it's for up to 21 days. Sometimes we can go longer if needed. We're still working on a case plan. They don't have to have parent permission when they first enter shelter, but within usually the first 24 hours, if we don't have some contact with the guardian, we do have to contact the Department of Child Safety to notify them about the youth, and then they make their decisions about involvement. But we try really hard to find safe family members or a safe guardian to help youth kind of assess their position and what they want to do, and then build a plan around it. I also want to share the youth shelter is all ages up to 17, and it is all genders as well, and people self-identify their gender, what they're comfortable identifying, but also who they want to live with within the program. Anyways, sorry, I'm really trying to get those runaway homeless youth beds out there in the community for people to know.
Our emergency shelter has a 32-bed capacity, and we have one transitional housing unit that has about six units for individuals, and then 2 that could have a parent and a child, or a parent and 2 children. We really don't have much more capacity than that.
Before I share, Shailene, how do I go about that youth shelter? I was very aware, and that's super helpful.
Yeah,
for me.
Absolutely. I can put the number in the chat, but it's 928-527-1800. There is a voicemail on there. So we also operate a crisis line that's answered 24 hours a day. The youth shelter, there's a voicemail because we're transporting kids, so we're not always in the shelter, but just leave a voicemail. And I should also, and I'm gonna use the acronym now. So RHY is what we call it, right? The runaway homeless youth. So our RHY beds, they are really about the youth wanting to use the bed. So it can't be used for respite. So like, oh, I just need a break. This is really difficult. The federal grant makes it very clear it cannot be used for respite. It really is about a kid wanting and needing assistance due to running away or being homeless. And so you know, if a youth is placed in the shelter, wants to enter shelter, and they are homeless and they're engaged with their family, that's fine. We keep the parents engaged. They can go hang out with mom all day long and, you know, come back and stay in shelter. It's not like they have to not have contact or something like that with their parents. But if there are issues at home, or of course they're trying to work with the youth to identify and make sure it's safe reunification or safe planning. So 928-527-1800, you can leave a message. It's a referral process. When it is the RHY bed spaces, yes, other service providers can refer youth, but then, you know, we'll be talking with the youth at, you know, at some point just to see this is what they want to do and they understand what it is.
But you said it can be for troubled youth as well, like those that may or may not have some trouble with the law.
Oh, yeah. No, it could be any kid that is, again, running away, is homeless, or at risk of running away or homeless. So, you know,
Right,
I'm not
habitual
going
runaway.
home. I don't want to go home today because I'm scared. You know, I might want to just go to Bob's house to hang out. Well, that's a risk of being homeless or a risk of running
Yeah,
away.
right. Okay, perfect. Thank you. I actually have a young child that could use. And then just to state, I have a 22 bed plus cribs and toddler beds, which is primarily sexual assault, domestic violence shelter. I have 16 beds in treatment, which is for women and children. I have 20 in sober living transitional housing. That's usually with some substance use or mental illness. I have 16 beds in a transitional house, and I have 10 apartments that sleep full families.
And I forgot to add, thank you, Shailene, for saying, so Sharon Manor is owned by Housing Solutions. So the other transitional housing in Flagstaff is called JoJo's Place. That is the 44 rooms. They are reverted hotel rooms, so it's like a family size of 2. But we are also opening some transitional housing in Camp Cottonwood called Oak Wash. That's under construction right now. It's next to McDonald's. It's an old hotel that we're reverting there. We were hoping to be done early summer, but we're running into the same issue we had with JoJo's Place, and that's electrical panels. So everything's going to be ready. We're going to be waiting on electrical panels, but likely that will open probably early fall in Cottonwood.
And how many
sorry,
beds? How many
32.
beds? 32.
32. And those
Yep.
are also reverted hotel rooms. So they'll be small, you know, singles or single and a child.
And do you know what the referral process will be like for that?
Not yet.
Because I drive by it every day and I'm like.
So for Sharon Manor, we have a lot of side doors, so to speak. Instead of just taking referrals from the program in Flagstaff called The Front Door through Catholic Charities and Flagstaff Shelter, I have side doors at Sharon Manor. So Northland and DCS and probation and the hospital. I take referrals from many different agencies. JoJo's Place is specifically through the front door. That's the only way to get referred. I'm guessing it's going to be similar for Oak Wash, but I don't know. Do you guys have a program like the front door down there where your community meets and discusses? Because we have something called case conferencing in Flagstaff, where Flagstaff Shelter, Northland, Hope Cottage, Sharon Manor, Catholic Charities and Flag Shelter, like all of the providers meet weekly, and then it, you know, referrals get diverted out that way.
Yeah, we do. I will say did the case conferencing, like with Catholic Charities and the Homeless Coalition, and then a couple other providers, but turnover has kind of halted that as well. And then so they're trying to fill the position here to start at the local case conferencing again. But that is kind of how like the referrals, at least through what Catholic Charities was case managing, to get into whatever housing programs, you know, they oversaw. So we would just encourage our, you know, participants to kind of go straight to Catholic Charities and do their intake. Because we don't use the HMIS system that they use. So in order to get through that system, they had to kind of go through there, which is fine. I mean, I'm more than happy to even, you know, moving forward, try to do that internally if, you know, I can do the same intake, you know, Catholic Charities does. I can do that.
I'm just not totally sure. And again, I think that's still in the talks, at least in regards to Oak Wash.
Cool.
But I'm guessing it's gonna be something like that. It's not domestic violence as an eligibility like Sharon Manor, and neither is JoJo. So my guess it's still gonna be one place that they're diverted to Oak Wash, but I'm not totally sure that that's been figured out yet.
Cool, okay.
Sean, I wonder if I could ask you to come on camera and share a little bit about what you've just put in the chat.
Okay. Yeah, I'm one of the resource navigators at our new Connection Center. We're built right next to the jail, like 10 steps away. A person gets released and they come in to meet with us. So we give them a nice environment to collect their thoughts, get connected with rides, and if we've identified any need for support, behavioral health, substance use, housing, transportation, will connect them with those resources. We've also had a few cases where in talking with the person, as myself or my counterpart Hema, we'll just sit and talk with the person while they're waiting for their ride. And we've identified domestic violence issues. And so we contacted our Family Advocacy Center and they've sent advocates to come here and meet privately with the person. We have 5 offices available to do that. So if there's any situation where you've either got a referral from us or you know of a person who's gone into the jail and they're coming out and you want to meet with them, make sure, do an intake or any other reason, you can come here and use our space to have a private meeting office. We also have a clothing closet. We provide hygiene kits, any shoes, jackets, depending on the weather, what they need. We've partnered with the food bank, so we have lunches available. Manzanita Outreach gives us waters, and St. Mary's food boxes, so that we can help somebody get their immediate needs taken care of so that they can worry about the bigger picture. And any questions?
I think it's fantastic, to see Yavapai County. I'm from Yavapai County, so I'm more familiar with the collaboration and cooperation between the justice system and the behavioral health providers. But I think this is probably good for Cassie to hear if you weren't already aware, being in the Cottonwood community and any of you in the Prescott area. Great collaboration and service. Have you seen an uptick in teenagers, domestic violence, folks coming through the jail that you're utilizing this for, Sean?
Not teenagers yet, because we don't serve the detention center. I'm working on reaching out with them. I've also been doing the human trafficking training that Applejack Ranch has provided, and their individuals are interested in going into the detention center and doing classes. So I'm working with a fellow health educator, Jake, who does classes over there, to do further outreach to the detention center and make sure we're providing the same services and have similar contacts. So we try to keep the population separate, because anybody leaving the jail can't contact anybody on the detention side. So that limits what we can do over here for them, but we can make sure they're aware of the resources. And my thing is, like, a lot of the parents may need support as well. So we want to make sure that they're aware that we're here for them. And a lot of the people we get are usually mothers, and it's the husband who ended up calling the cops, even though they were the one that was more abusive. But it tends to be the case here that the first person who calls the law enforcement is the victim, and the other person gets taken off to jail. But that does help us contact the person and make sure that they're doing the right steps to end that situation or get out of that cycle. Unfortunately, there's usually kids involved, so that adds an extra step. So they are building a connection center in the Verde Valley with the jail there. It's not fully operational yet. They do have release coordinators inside, and they help connect with resources. So yeah, it's slowly improving instead of what was in the past where somebody just get released into a parking lot and have to figure it out themselves. So a lot of people that come in here are just surprised that we exist and that somebody is actually being nice to them and looking out for them. So that we've had people come back and one guy I gave a jacket to, he came back the next day, returned the jacket, and asked for anger management support. And we have had others, they're just lost in a spiral of the chaos because they don't know what to do next, and grown men crying. But we help solve their immediate issues with how am I going to get home? I don't have any shoes. Some people, especially a lot of the domestic violence cases we've had, the women were arrested without shoes because it's late at night, and so we've helped give them those items. So it's just, again, one less worry.
Good work.
This is really wonderful. That's really inspiring to hear that there's a programs like that. I didn't even realize that there were, and I really hope you all are talking to the Coconino County Sheriff's Office too. I know they're trying to hire a new chief of police, so maybe that's a great opportunity to to have that discussion if it hasn't happened yet.
So what kind of trends are we seeing coming through the shelters? Families, what about human trafficking?
Yeah, so at Northland, we have a program. We have a director of human trafficking services, and then in 2017, we started the Flagstaff Initiative Against Trafficking. It's called FIAT. We love our acronyms in this field, as you all know. So FIAT does trainings, a lot of trainings with law enforcement and medical providers, as well as community service agencies. They also, around 2018, started asking organizations to start asking about trafficking, to really start identifying data and numbers within the Flagstaff community. Since then, they have, and I don't have the exact numbers, but they've identified over 500 people in the community, of which I think maybe 80 are youth, which we know is probably really underreported. Mostly youth identified through juvenile probation data. And then what else was I just going to say about in our shelters, we see in our shelters, specifically at Northland, we see a lot of people not identifying human trafficking as primary victimization, but when you ask about it or explain it, it comes up as a secondary victimization of something that they have experienced, either as a part of their domestic violence or current abuse or former situations that they experienced, including trying to leave the relationship in the past and having to do different things, whether it's sex trafficking or labor trafficking, to be able to leave, a currently unsafe situation. But definitely, for us, it's been very much an eye-opener over the years of this has always been happening with our clients. We just didn't know how to define it and ask about it. And now that we do, we're able to teach clients and people about it. And as they identify this is something I experienced, be able to to, name it and then provide the support around what that experience and that trauma is for them.
Anyone else on trends that you're seeing of who's coming through and how long are people staying?
We've been seeing an increase in people coming down from the valley, trying to relocate out of Phoenix, Maricopa County, all of it. Not that we, haven't had that in the past, because, we'll accept anybody who's actively fleeing. But our hotline is nonstop. We've had a huge increase in phone calls, obviously regarding housing. I would probably say within the last, even just 6 months, the increase of calls that we've been getting, for people trying to relocate. And I think that has a large part to do with just the housing crisis in general. People are trying to reach out to anywhere that'll accept them, to try to get a stable, bed for a little bit. And we don't have a lot of specific resources for the unhoused, we're limited, unfortunately. So we end up having to refer out, and, deal with things like that. Our shelter stays have been increasing. We are staying full pretty much always, just because the clients that we do have in shelter and get in shelter are utilizing the full 120 days that we allow, because there's nowhere to go. So we're having to do a lot of other referrals and unfortunately turn people away just because we don't have the space, because we're staying pretty full.
Are we seeing people move from one shelter to the other?
Yep, a lot. And unfortunately that's, with, other people on shelters, like, we get it, because it's like we do the same thing other shelters do, of like, all right, your time's up. Unfortunately, this didn't work out. So how can we, help relocate you? And a lot of times it's them relocating to another shelter, which stinks, because then you have to just kind of start all over, from what they've worked on and built here during their time with us. And it's really, sometimes it feels like a never-ending cycle of just kind of transitioning from place to place.
And we've, oh, sorry, Corey. I know I already talked. I'll be real quick.
Yeah, go ahead.
We've seen a huge, a large increase of people reaching their full stay, 120 days emergency shelter, and still not having housing in place, and not even that first step to housing. And that has, I think, hugely contributed to some of the mental health that we're seeing amongst our clients, but also it's we've seen it really projected onto our staff of it's your fault that I don't have housing, despite it being a larger community and statewide, nationwide housing crisis. But when you're actually the person experiencing that crisis, it's not what you want to hear. So yeah, we've been experiencing that as well, which I see a lot of people nodding their heads. So I imagine, yes.
Absolutely, ditto here. Informally, in the Prescott area, if sometimes we have folks who haven't started that process, aren't ready for it, aren't motivated to do it. Well, then once they get closer to that time, and we've, from the get-go, we're like 4 months goes really, really fast. But if they're not really doing the stuff, we'll let them move on to the next place. For those who have, and this is what I mean informal, it's not like a policy, but those who are busting their ass and they're on all the lists and they're making the follow-ups and stuff, they don't leave. We've had people here for 6 months, and then we keep checking in, and they're next on the list, or this unit just has to open up, it'll be April 1st. So I don't have them move on and start over again somewhere else if they've kind of gotten on the list, they're following up. And so we have extended the shelter stay for folks who are moving and have gotten their names out there or are trying to be creative. I don't want them to have to start over or try to move to the Verde Valley or move to Maricopa County. We also have had lots of folks leave here and move down to the valley where there's some different types of opportunities. I know the housing there's awful too, but that's one idea, is if somebody's doing the work, or especially if they have a job or they have daycare, all that stuff is so hard to start over somewhere else. So we have extended stays, or we've gotten creative with multiple people in our transitional housing, splitting rent. So we've tried to use those spaces for as many folks as we can without having to have them move on just because of the time limit.
Like Shailene said, and you guys are, I am seeing, I'm usually, people are coming to me after the shelters, and it's usually multiple shelters. So a lot of Shailene's people are coming over to Sharon Manor, but sometimes they have to go to Hope Cottage for another 4 months. My wait lists just keep, in the last year, each month is increasing the amount of people that are coming on. Once they get to Sharon Manor, they sign 1-year leases and can stay up to 2 years. The problem is moving out because there's no affordable place to go. And so my case managers here, if you meet with your case manager, it's encouraged, it is not mandatory services here. So if you're meeting with your case managers, one of the first things that they're doing is trying to help you find permanent housing for outside of Sharon Manor. Housing Solutions, who owns Sharon Manor, is probably one of our biggest advocates for my boss for affordable housing in the northern region. They just put out the rental attainability reports for Flagstaff. And I think the newest one is in the high 70,000s of what you need to make to be able to afford to live in Flagstaff. So you can imagine most of our residents are obviously single, on one household salary, trying to move out of Sharon Manor. It makes it incredibly difficult when the housing authority wait lists are taking 3 years of being on there. So even if you apply as soon as you get to Sharon Manor, chances are you might not make the list before you need to leave. I am able to do some kind of extensions in that 2 years. If I know you're on lists, if I know you're about to top of this list, if it's just another few months here or there, and you've been actively working, then I can do increases. But technically, transitional housing's definition is 2 years. So even getting on some of the low income property wait lists are 3-year long to 5-year long wait lists. So it's just, that's one of our biggest challenges, is where's a safe place for people to go when they leave here. And I'm going to break people's leases. If the housing authority, which they love to do, call and say, next Friday, we have a place for you. I'm going to let somebody break their lease, because that's the whole purpose of Sharon Manor, is I'm not going to be like, sorry, you have 6 more months, too bad for the housing authority. But just really, that's our probably biggest challenge besides mental health, is where to go when you leave Sharon Manor.
So when it comes to substance use, I know you all have rules, and you've got to keep the environment safe and clean for those. Are you seeing any trends, any issues with having to vacate people because of substance use?
At least at Sharon Manor, which is different than a shelter space where it's affecting everyone. In the last 10 years, Sharon Manor went from everything being mandatory. So there was drug testing, there was all of what I consider punitive, and our thinking today, to be able to participate in the program. We obviously can't tell you what you can and can't have in your apartment. They used to. We have been seeing some occurrences of relapses, but that's what I've been really happy with is people are reaching out to their case managers. So they're feeling comfortable to call their case managers and be like, I relapsed, I need support, this is what happened. And then we hit the ground running on trying to help address relapse. People that deal with persons that have experienced substance abuse, and I would try to teach this to our interns now and at DCS, is you have to understand relapse is a part of sobriety. And so it's likely going to happen. And how do you address it at your agency when it occurs?
I'll
Okay.
piggyback.
Yeah, go ahead, Stephanie.
Sorry, piggyback from there. I speak on that heavily with relapse. It takes, it's a national statistic that it takes 7 to 9 times for a victim to leave their abuser. It's the same sometime for relapse. And again, we've kind of had to set back on some of our rules with the living, depending. If they're in our communal living, we can test regularly. And that's fine. And we can search, certain things they bring in. But the apartments or the transitional living and the housing, we can't. However, I do inspections every 3 months, and we watch, and knock on wood, like everybody's kind of come forth. So it stops them from setting, we call it slicing all their 3 tires. They might slice one, but they don't slice all 3 because they're there where they can reach at a short distance to their case managers or their, help. But I think that's a big part of training. Substance abuse comes as well as victimization.
Excellent. I know there are programs in other parts of the United States where they recognize that housing comes first. Sobriety doesn't, housing does, and sobriety will follow. So another question I have for you all is, when it comes to a crisis, a behavioral health crisis at one of your facilities, how have you found the crisis response? I think that Cassie said one of you said you have a good response with crisis when it's needed. What is that kind of across the board, looking at Kingman to Flagstaff to Cottonwood? Prescott.
Because we are lucky in Prescott Valley area that Polera Health runs the crisis stabilization unit. And so it's a 24/7, specifically behavioral health and substance abuse response that we can take somebody to. And so if they're actively using or they're having some kind of mental health crisis on one of our facilities, we'll say, here's what I need, or here's what I'd like to do. And we can physically take them there and say, here, this person needs help for these things. And they could get checked in, they could get evaluated. But sometimes we've worked with them to say, kind of like Cassie said, this specific thing is beyond what Stepping Stones advocates are trained to help with. So there have been times that we've gotten APS involved or other people to say, potentially they can't leave that place and come back to shelter, or here's what needs to happen first before they can come back to shelter. And it doesn't even have to be the super serious. It can be like the other day, someone was having suicidal thoughts and we said, would you like to go talk to somebody over here and see what they have to say? And so they spent the afternoon and kind of came down, got their meds reevaluated and came back to us. But that's an amazing response versus call your therapist or make an appointment with a counselor and you can talk to them in a week and a half or something. And then again, we also lean heavily on our recovery community and talk to folks about, did you call your sponsor? I mean, not for mental health crises, but just for the day-to-day things. We're constantly trying to reconnect people with their fellowship to get support. So we're not only relying on the professionals. And in our community, police officers don't have to decide to take someone to the ER or arrest them. They can say, let's go to the crisis stabilization unit and have this person assessed or give them a hand when it's not appropriate to arrest them or take them to the emergency room. So that's just in our community. We're lucky for that.
Yeah, I would agree with you on that. Stephanie, up there in Kingman, what do you have if you need a crisis response team to come to one of your shelters?
So we have Taros, I think is how it's pronounced. I'm not super familiar because if I'm being completely honest, most crisis, the team is me. 24 hours a day, 7 days a week, myself and my VP when it's at our shelters. But like this morning, we have a woman that probably needs she came from the Valley a few days ago and she needs some MAT / med management, if you will, for mental as well as substance use, or we'll say withdrawal. So we have the proper staff that will take her to KRU and she'll do a 3 to 5 day evaluation. So we kind of, where I wish we had that service that they have or that facility, Taros is mobile. They'll come to us, and they came to the safe house not too long ago and evaluated a girl, but they don't see what we see. So then it becomes, they just do a little intake evaluation. If you answer the question, who's the president, what year it is, we can't, further assist, which is kind of defeating the purpose, because us as staff or the shelter attendants struggle with, no, listen, she tried to set the house on fire. Like, there's a problem here. But so we have an amazing relationship with KRU on every aspect, whether it's withdrawal and med management, substance use, and mental illness. So as well as the jail there in Kingman. So we do work hand in hand with both of them for any crisis we have with anyone in our facilities.
So do you feel like if there's crisis, are the needs being met, or you are meeting them?
I do. I think there's some more that could be done. I mean, obviously, I'm sure everyone on here right now can say transportation and housing are our two biggest problems. Transportation always has been, and I want to say that I hope it's not always, and housing is still an issue. We've seen the influx in cost of living, but yet not the influx of employment or salary, if you will. And then that makes it more difficult for the single family or the rebuilding family. Let's just say, whether they're not single or not, the rebuilding family from a mental illness and or a substance use and abuse history, as well as a victim of any crime. It takes a rebuilding time, and we make it very difficult right now. I would say the world, with lack of transportation and funding for housing, makes the rebuilding for any of these things difficult. We as entities and different organizations are there stepping as far as all the resources that they have, but I'd like to see it get better. That resource, if you will, the crisis resource, or a prevention team, an intervention team, if you will. That's something I'm hoping we get to work on this next year, and I'll fight for that and some grant funding, I'm sure. But if I had to say again, like everyone else, transportation and housing. And I say that
Okay.
with great thanks to we just got a new house. I think we closed probably sometime in April. So hopefully we'll open in May or June. Beautiful home that's going to sleep anywhere from 8 to 10 women and children, and it will be transitional housing for substance use and exposed through DES. I work hand in hand daily with DCS. So those moms that are still in open active cases with their children, but still have babies and kind of things. So that house will be a huge, having them all there together is better than having, right now I have them kind of split out. So, but yeah, that's where we're going at. And our list as far as house funding, I looked at it this morning and I thought, just because I have 4 clients on it, and she's been on 6 years and she's still 343.
Mhm.
And she's a mom of 3 children.
Yeah. So
Sometimes-
what about anybody from Flagstaff? If you need crisis response, what has your experience been?
We do immediate crisis response on the daily here, I would say. You never know what's going to happen, but there's usually something. So we typically respond to the immediate crisis, and we like to say we're masters of resources. So then we start reaching out to diverting which way. We do have crisis response. They're not always quick. The last time we had a crisis spill over from the apartment complex next door, we called mobile response. They didn't arrive. We dealt with the crisis, and actually myself and my coworker ended up driving somebody to Northland ourselves. So I think it could be bolstered a little bit, at least like emergency crisis response in our area.
Okay.
Yeah,
about-
Flagstaff, they established the crisis response team, a year or so ago, as a way to divert from law enforcement and 911 responding. So I haven't worked with them too much, but Teros is also typically our first call for like mental health, suicidal ideation crisis outside of our therapist getting involved. And then we just make the plans from there. And Teros, usually they're supposed to follow up within 24 hours of responding to that crisis to kind of re-go over the safety plan, et cetera, with clients if it is related to self-harm or suicide.
Are you seeing that follow-up happen?
For the most part, it typically does with our youth. I think we know that because we're allowed to know that in our youth
Yeah.
shelter, versus an adult, they might have direct contact and we're not knowing if they actually did follow up or not. But we do see that with their youth, or we will reach out to Teros and request that follow-up if we need it.
Shailene, I'm curious, are you calling the CARES team or are you calling the crisis line?
I don't know which ones that they call. I don't do direct service, so I'm not sure if they're calling like our local response crisis and they're getting connected to Teros, or what phone number that they're using.
Lori, do you mind if I speak for a minute?
Please do, and come on camera. I was waiting for you to opportune moment here.
Well, this is the part of the conversation that I get to be a part of. So for those of you that don't know, I'm Bill Mitchell. I represent Care First. We're the Regional Behavioral Health Authority for both Yavapai and Coconino counties. Yes, Stephanie, we do cover Mojave County as well. We have 12 of the 15 counties in the state that we are responsible for crisis services. For those in the group, and Lori's had me on before to speak, there is a statewide 800 crisis line for you to reach out and get additional resources.
Having a little hard time hearing you. If you get your microphone better, thank you.
How about now?
Better, thank you.
Okay, good. So that number will tie you into additional resources, not just in the individual areas you're in, but it also branches out countywide, and then it acts as a safety net for other additional services throughout the state. So I don't know if any of you have had any of that information. I know, Shailene, I've talked to some of your folks there about this service. We've taken over as the REBA in October of 22. So this service has really been new to the area, new to the communities as far as having a single point of contact. Some of you may be familiar with the old 877 phone number. That was the old crisis line phone number used throughout the northern half of the state. That number is still implemented, but what we have is a brand new access approved statewide crisis line that in one call across the state will get you the same resources that you really should be using for crisis services. Rather than calling the individual entities directly, it allows you to contact and have oversight over that call, so you can get additional follow-up to find out if services were rendered or if there's additional services needed. It is a great resource for you guys to use as far as trying to contact crisis services that you need for additional resources.
Any questions for Bill?
Yeah, Bill, give us that number so I make sure that we have the updated one.
I will throw it in the chat for you, and then I'll put my contact information in there as well if you need any additional resources. Like I said, I cover Coconino and Yavapai counties. I do cover a little bit helping our guy in Mojave County just because of distance. But I go throughout the northern half of the state from Apache County to Mojave County. So if there's something additional resource wise you need information on, or just need resources for crisis response things, reach out to me, but I'll have my contact stuff in the chat.
Thanks so much, Bill, and I'm glad that you're able to be here today for this panel meeting with Mental Health Monday. And I think that for those of us who've worked in the system for many years, we're used to calling that local dispatcher. We have that number, we know that number, but when you do that, you don't have the protection of the oversight that the state number has. The state number contracts with that local provider and holds them accountable and records all the calls that come in to the state number, and then they can do follow-up. If you want trainings for your staff on that, connect with Bill. He can set you up with it. They've got a great PowerPoint, great training. You know, we're not about getting anybody in trouble. We're about getting people the help they need when they need it in the right, you know, timely manner. And with the rural areas that you guys work through, it's challenging. All right. So, any questions, any comments, on the discussion that we've had today? I want to thank every one of you for taking time out of your busy schedule. For those of you that may not have met each other prior to this, I think that networking is crucial. And Cassie, I just want to say something about your shelter, because I've worked in your community. I worked for 16 years for one of the behavioral health providers, and I've been to your shelter. And I know that you have a dog kennel, and I'm an animal person. And I think this is something that when we look at families that are broken up and experiencing the kind of trauma, to be able to bring their pet with them is something that if the other facilities aren't doing, they might talk with you and see, well, how did you do that? How did you raise money to get those kennels built? And how does that work?
Yeah, we've kind of expanded on our pet friendliness a little bit. We started out just utilizing we had one room that was designated as like our pet room, and then we had outdoor kennels that they could utilize. But now the whole facility is pet friendly. That comes with challenges, sure. So that part is still kind of new to us, that we navigate every day of trying to hone in on what really works. But I mean, we all operate in just a bunch of gray area anyway. So what works today might not work tomorrow, might not work next week, but you know, we're trying it out. And it has made a huge difference, because I mean, we've all heard those crisis calls of they won't leave if their pet can't come, or they'd rather just sleep in their car if that means that their dog gets to stay with them. I mean, we are still smaller, and there are still parameters on, you know, maybe how many animals we can have at a time, but we sure have increased our pet services. So like I said, it comes with its own set of challenges, but overall it's made a world of difference.
I'm so jealous. It's the one thing I've been working on for years. I have a great organization actually in Las Vegas called Noah's Place that I work with. They will foster for any of our insurance-based, you know, someone we know is going to be with us for their home health for, you know, 3, 6, 9 months a year. And I'm a stalker, so built on that whole number of following my clients to make sure that they're successful. My struggle is letting go, but I have an organization in Vegas that will foster for up to a year any animal, and they help me. We meet halfway and we come get, so they're helpful, but I can't tell you how bad I wish. And I have the yard. I have the space. I just need the money and like the insurance liability to be able to have it. I'm going to work on that some more now.
Yeah, we recently just received a grant through Red Rover for about $60,000 that's going to allow us to expand our outside pet shelter like, I don't want to say services. So we can get like indoor, outdoor kennels, kind of like I guess you would see if you were to go to the Humane Society, that are larger, and then hopefully get some of that money to our transitional unit to also provide like a play pet area, because we do allow pets that are transitional, but we don't have an established yard yet. It's there, it's rock. We just need to develop it. So
Yeah.
we're hoping to be able to transition that throughout both the shelter and transitional to just make it a little nicer.
Yeah, that would
Yeah,
be
Stephanie,
great.
check out Red Rover. They are dying to give people money. They have so many trainings.
Right.
They have handouts of, here's how you can make pet friendly spaces. Here's ideas. Here's people to partner with. They want to give you money today. So
I'm calling them
seriously, they
today.
are all
I'm
about
gonna
it.
email somebody, because the only other, I always, every time I look at it is, we hit really high temperatures versus some of your areas, Flagstaff and stuff. So, you know, if I could only tell you, that's the other part. I have to set up cooling stations during the summer, and the heat is the hardest part for us when it comes to animals and children and elderly and etc. But I'm going to Red Rover. I don't know if that's in my little list of things, so I'm super
Yeah.
glad.
Yeah, they've been really great. They're a good point of contact. And our current kennel that we have is air conditioned and heat, so we're able to kind of alleviate the worry of someone leaving, their animal outside while they go to work, because it is air conditioned and heat.
Oh, good, good.
Well, excellent. Looks like we're gonna get more dog friendly at some of the shelters. So I want to let you know that Bill did put that information in the chat. I encourage you to take a picture of that with your camera or however you want to capture that. Again, I want to thank you all for being here today. I encourage you to be in contact with each other. If you'd like to be on the email list for the Northern Arizona Parent and Family Coalition, let me know and I will add you to that. I don't like to do that without people wanting it, because we all get so many emails, but it would be used to give you notification of our meetings, which is once a month, the third Wednesday of each month from 1 to 2:30 via Zoom. It give you the opportunity to receive community announcements and provide them to me. I send out flyers to those on the email list. And I encourage you to visit NAMI Yavapai for future NAMI Yavapai events. We partner with them to do this Mental Health Monday. With that said, have a great rest of your day. Thank you all for doing what you do. I'm so thrilled to hear that you're doing the vicarious trauma training. You're taking care of yourselves, your staff, and those that you serve. And that's a big piece. That's a lot. So thank you all.
Thank you.
Yes.
Bye.
Thank you, guys.
Yeah.